Okay, we're going to begin our press briefing. Good afternoon, everybody. I'm Peter Zanoni, the city manager for the city of Corpus Christi, and this is our regular COVID-19 briefing for the community to help the community understand our situation with COVID-19 and to help them make good decisions every day, but especially now with the holiday weekend upon us, the 4th of July holiday weekend. And with me today is Mayor Joe McComb. He'll speak after I speak. And then following he and I, we'll have Annette Rodriguez that'll be live stream from a remote location, as she has been the past couple of days. And then Nueces County Judge Barbara Canales will also have a video to share with the community. So she'll be here through video later in the presentation. What I'm going to do is go through our numbers, and then I also have a couple of slides and a couple of screens to go over the orders that the judge has just signed. So that will be released to the community. The one on the curfew. So I have the one here that was just signed by Judge Canales. That's going to be made available to the public as we speak. The draft order was available yesterday, but the judge did just sign it and file it. And so we have that for the beach access. We also have the one the judge talked about yesterday for the face coverings. And so this will be shared, put on both the city and county website. But this afternoon, I want to make sure the community understands the beach closure, beach access closure order. And so I'm going to go through a couple of screenshots that helps break it down and gives the community a better understanding of what we're doing over the 4-day period from Friday through Monday. Okay, so those are the two things I'll be doing, and then Mayor McComb, and then we'll have Annette, and then the judge. Okay, so let's begin with the statistics. Unfortunately, we have another record-setting number for today, which is nothing to brag about. This is a real bad situation. So for today, July 1, we're reporting 362 additional new cases for Nueces County. And Dr. Bird last week, with his analysis, predicted we'd be around here. I think this actually surpasses the number he thought we would be at through our predictive modeling. So what we're saying in terms of preventative measures and some of these things we're doing, like trying to keep people at home by restricting access to some of our beaches and parks, is all to drive that number back down and stabilize the number of new cases. Even with these restrictions, cases will continue because we're in a community-wide spread situation at this point. So 362 for today. You can see it's been a bad week in terms of numbers. It was 274 yesterday, 205, and so on. Another big number, the 259. What this number does, or what these numbers do, is for the past week, when you look at our average numbers per capita, so when you take population into consideration, Nueces County is the highest growth area for new COVID cases of any metropolitan county in the state. Okay? So that's why we're doing some of these stay-at-home measures in the powers that we can, the judge and the mayor. It's because at this point, we have the highest number of new cases per capita in our county compared to any other metropolitan county in the state of Texas. And that's nothing to really brag about, but that's where we're at. That high number today of 362 is also comes with no mass drive-through testing site. So these are from tests that have been performed maybe days ago from the National Guard or from hospitals, commercial labs. It does include some limited testing from us, but we will begin again our drive-through testing sites tomorrow. And so I asked Dr. Bird earlier, I said, what should we expect? You know, is the number going to be 400, 500 tomorrow? We don't know that answer, but what will happen, as the modeling shows, is that we're going to reach capacity in terms of testing. Our testing apparatus or system can only test so much, right? We only have so many supplies, so many people. So eventually that number is going to kind of taper off. It's not going to continue to grow because we can only test so many people given the apparatus, the personnel, the testing supplies, the testing labs, and so on. Okay, so that's it on the new number. So 362 was a record for today, record for all time, in fact. Okay, the next chart here is our donut chart. This kind of just puts in perspective the active cases to the recovered cases. And so with our exponential growth that's happening in new cases, obviously the new cases outweighs the recovered. 88%, almost 90% is in that dark blue, the 2,416 active cases. You're going to see the number 9 on there on deaths, and I'll go over that in a moment, but we had one additional death late last night or early this morning, and that brings our death total to 9 now in Nueces County. Okay, number of persons in the hospital is going up as well. We have a 62% increase, and I do need to give you a little bit of background on the number or disclosure on the number. So the 170 persons that are in the hospital is a 62% increase from yesterday. The hospitals up till now have been able to differentiate between who's a Nueces County resident and then who's not. Our hospitals around here take patients from immediate counties, right, from San Patricio County and others. So the 170 number includes not only Nueces County residents, but other area residents from the Coastal Bend. Those other residents, though, is probably a small number. It's not a big number, but the hospitals just don't have time to break out the number, so we're reporting the full number today. 170 persons in the hospital. That's a 62% increase from yesterday, where we had 105 yesterday. And the number of persons in ICU recovery also has gone up 75%. And today we're at 58 persons in intensive care. And this is where persons are most critical in terms of the virus. We still probably have a few ICU units left, but that's a fluid number in terms of the number of beds and the staff to manage them. But 58 is a big number for our immediate region. And you can see going back to just a couple of days ago or a week or so ago, we only had 5 people in ICU. Today we have 58, so that's a huge increase. And then we have this chart here on death. So I reported just a few minutes ago that we had our 9th death. This individual was a younger person in his 40s, his early 40s. And he did have a few other comorbidities, but still, it just goes to show that age is really not an issue when it comes to death of COVID. So in the last 3 days, in the last 6 days, I should say, this would be our third death in the last 6 days with this gentleman who died earlier this morning or overnight. So the graph here is a line graph. It just shows you, the reason we did it is to show you that not much happened for many months in terms of deaths. We had 3 deaths over 3 months in March, April, May. But in the past couple of weeks, that number has grown by 3 times to 9 deaths in the county. Okay, and then we have some daily averaging and some trend graphs here we can show you. So this is the testing chart. It shows on the red line and the blue bars. Those are the blue bars going up and down are the tests that have been reported. It's not necessarily the tests performed that day. There's a lag in this indicator. Because people submitting or entities submitting tests to us, they may wait and batch them and send a big number one day, but it could account for tests that have been taken several days ago. But it's a good indication generally of what's going on in the testing. And so the lines up and down show the number of tests reported per day, where the orange line shows a running average, a running 7-day average, which entities are using in this in reporting information to communities. And you can see both are going up at the end down there. So we have some pretty big test days happening, but our 7-day average is up as well. And the 7-day average as of today is about 540 tests that are being performed every day on average, 540. And then when we look at the number of new cases, we talked a lot about that in the beginning, but this chart really puts it in perspective. We're back here in April when we had things under control, and we were reporting 4 and 5 cases maybe per day, a lot of zeros as well, you might recall. You can see the average was very low, the red line. We had what we call the first wave around here. The second wave was there, and then you can see the third wave obviously is a pretty significant wave. So on average, our 7-day average is 250, approximately 247 to be exact, but about 250 new cases per day on average for the past 7 days. You can see the exponential growth that's taking place down there at the end on that chart. Okay, now earlier in the week we reported on several outbreak areas, and that's why we had to suspend some of our drive-through testing so the health district could attend to some of our senior centers, senior nursing homes, as well as the Corpus Christi State Living Center, which is an assisted living center for persons with disabilities that the state runs. And we want to put this map up. It's going to be a little bit hard to see, but I think you can get the gist of it, and I'll try to point it out to you. This lists 9 entities where there's outbreaks that are taking place in the city or the county. And there's really 3 main areas. And so down here on the south side, there's 4 areas. I'm going to point them out to you in a moment, right here. Kind of on our deep south side by the Oso, kind of. There's four entities: Elon, Corpus Christi Assisted Living, the Solstice Senior Living Center, Vieira Senior Living, and Villa South. Those are 4 nursing homes where there's outbreaks that are taking place, and the staff are trying to help manage it there. Then up here in the central city, we have 2 areas. That's the Corpus Christi State Living Center and the Windsor Nursing Home. So I'm going to point those out to you. Right here. Down there. So that's another outbreak area. And then the third area is up in our Cal Allen area in Robstown. So up here in Cal Allen, and then just right down here, there's 2 final centers, nursing centers, the Villa Northwest and the Regency Health Services. And then a third one at Robstown over here. That is Ratama Manor Nursing Center. So all those nursing homes have the outbreaks, and the staff are doing testing the seniors, testing employees, and trying to manage these outbreaks to contain them and help people stay alive, frankly. Okay, so that map's there, and we can make it available if somebody needs a close-up view of it. Okay, so that concludes the overview of the statistics for today. And what I want to do now, we're going to put up a new presentation, and it's just going to be, I'm going to just walk the community through so we understand. I think having gone through the numbers, you have a better appreciation for why the judge and the mayor have put some policy restrictions in place, and that is so that people are more encouraged to stay home over the 4-day period from the 3rd of July through the 6th of July, this holiday weekend. As Annette will tell us, and as people have been telling us, we need to stay home as much as possible. We do not need to be going out. We need to try to break this spike that is happening in our new cases and drop that curve to flatten out and then eventually go down. Okay, so what I want to do is go over with you our temporary park and beach restrictions. And there's 3 things we're going to cover. The judge and reciprocating the mayor have put into place beach access restrictions. We also have beach curfew restrictions. And then for the city, we have park access restrictions as well for the holiday. These 2 are going to be the same timeline, the beach access and the park access. It's the same 4-day period. The curfew is a little bit longer of a period, and that's one of the things we're going to go over here with you in a second. Okay, so let's start with the Bay and Gulf Beach restrictions and curfew. So the order that the judge just signed and that we talked about yesterday is that temporary vehicular access restriction will begin this Friday at 6 a.m. and it will end on Tuesday, the 7th of July at 6 a.m. So that's a 4-day period. And what that means is we're closing city roads onto the beach. The General Land Office controls the beach, and the beaches are open for persons to walk on. However, the city has the ability, and the GLO has allowed us to do so, to restrict access, and so that's what the order has done. We have vehicular access restrictions for 4 days at the beach. The curfew is to curtail persons at the beach as well. It starts today at 8 p.m. on both our beaches at the bay and the Gulf. 8 p.m. at night to 6 a.m. The curfew will be in place today all the way through next Saturday. And on July 11, it'll be lifted at 6 a.m. Okay, so the rest of this week, all of next week through Friday, and then Saturday, the curfew will be removed. Now, vehicular restrictions do include golf carts and all-terrain vehicles, with the exception of ADA, and I'll get to that in a moment. But persons living down on the Gulf beaches in particular will not be able to take their golf carts or all-terrain vehicles onto the beach, with the exception of ADA permitted ones. Now, one key thing, though, is we do want residents and visitors to be able to walk on the beach. It's an open beach to Texas. It's in our Constitution where we can't close them. And so walking and biking, somebody asked me, can you bike on the beach? You can bike on the beach. You can walk, run, swim, fish. You can fish on the beach. We do encourage social distancing, though. If you're walking, try to stay 6 to 12 feet away from especially people you don't know. So that is permitted. That is the case both for the bay beaches as well as the Gulf beaches. You can walk, you can swim, you can fish. On the bay beaches, let me see if I'm going to cover it here. I'll cover it in the next slide. Okay, so social gathering, picnicking, or camping is not prohibited. We don't want groups of people hanging out on the beach as we normally do. And that goes for both the bay beaches and the Gulf beaches. Okay, so the bay beaches, just a little bit more breakdown on them. The bay beaches include McGee Beach and North Beach. Now, last night, late at night, I was talking to one of our constituents, and McGee and North Beach, while the GLO owns those technically, like they do the Gulf beaches, we have a lease with the GLO, so we actually can regulate what happens on those beaches. So for the McGee Beach and the North Beach, persons can walk on the beach, but we don't want any camping or any picnicking, no tents, no umbrellas, no chairs, no sedentary action on the beach. That's true for McGee Beach and North Beach. We can, as I mentioned, we have a lease with GLO, so we can dictate what happens on those beaches. So we will allow people to walk, run, jog, fish, swim, but we don't want them to set up permanent resting spots just to keep people moving. We don't want big groups forming. We're also going to cancel lease agreements that we have for those 4 days with some of our vendors. And so on the beaches up here on the bay, there's a cabana rental outfit, and then there's also an outfit that rents jet skis. We're going to temporarily suspend those for the 4 days as well, because the whole goal is to keep people at home, keep them away from other people, so we certainly don't want a big group of people on jet skis catching COVID. So this shows the access closures. I kind of hit the high points of it earlier, but these are all the roads that will be closing. These are the ones that are in Nueces County, but north of that, Port Aransas is closing theirs. And then south of our boundaries, the Padre Island National Seashore is also closing access. So there's about 100 miles of beach restriction that'll go in place by the entities to include Port Aransas, the city, county, and then the federal government. There is one section of beach where the state park will still be open, Mustang Island State Park, but it's reservations only, and it's a narrow stretch of the beach, so that is something we couldn't control. Also, not really an ocean beach, but we do have what we call Sunrise Beach. That's an RV park and a lakefront area up in Mathis. That's where Lake Corpus Christi is, one of our significant bodies of water that we use in our drinking water here in Corpus Christi. So the picnic and the waterfront areas will be closed for that same 4-day period. So that's important if people usually head up that way for the 4th just to get out of town. It's beautiful up there. I was up there myself a couple of months ago looking at our facilities, but we're going to close that facility. And so don't waste your time driving up there because it's a good, I think, a 45-minute drive. So the Sunrise Beach RV Park and campsite will be closed for those 4-day periods, and we're not taking any reservations for RV hookup as well. Okay, now ADA accessibility. So we're being mindful of that. We've heard some communication, or we've talked to some constituents and interest groups and the GLO as well. We do have to maintain ADA accessibility for those that are ADA handicapped. And so the way persons that are in a vehicle or in a all-terrain vehicle or golf cart that have the ADA emblem and are permitted to be parking or using a four-wheeler or a golf cart with an ADA permit, what they will do is use the Packery Channel parking lot. That parking lot will not be closed, and that'll remain open. That's important for the boat ramp that I'm going to talk about as well next. But somebody with ADA, needing ADA accessibility, they can park at the Packery Channel parking lot. And then also at the Padre Bali Park, the Bob Hall Pier, which is a picture over here, that will be the entry point for somebody that has a golf cart that is permitted to have used by somebody with ADA, American with Disabilities Act permitting. So we're going to have ADA access at those 2 points, and at Packery Channel and at the Padre Bali Park. The Packery Channel is for vehicular parking with a permit, and then the Padre Bali Park is for somebody actually in a golf cart or an ATV that has a permit. Okay, and then we got some questions yesterday. Can we take our boat? I guess that didn't make it in. Maybe in, but let me talk to you about it now. Some people have asked, can we still launch our boat? And so the city controls 3 boat ramps down on the Gulf beaches. There's one at Packery Channel, and then there's 2 that we technically own under the causeway, under the JFK Causeway, leading to the beach. Those we lease out to a bait and tackle shop. So those 2 are open. And the boat ramp at Packery Channel, if we go back to that prior slide, that boat ramp is open because that whole parking lot is open. And so persons that want to launch their boat, that parking lot will not be closed, nor will the ramp be closed. And so you can take your boat and leave your vehicle and launch your boat from there. You can also launch your boat from the 2 that are underneath the JFK Causeway. And fishing from your boat and fishing from the beach is allowed as well. Okay, and then we want to let everybody know, if you are walking on the beach, we want to make sure we keep our residents safe, and that's the whole reason we're putting the restrictions in, is to keep people safe. But we will have our lifeguards on duty as normal for all our beaches over that 4-day period. And just to remind you, our lifeguards at the Gulf beaches is every day of the week, 11 a.m. to 6 p.m. And then at McGee Beach, our lifeguards are every day of the week as well, 11 a.m. to 6 p.m. And then on North Beach, we do not have lifeguards at any time, so there won't be any there on that 4-day stretch. But on the Gulf beaches and McGee beaches, we'll still have our lifeguards as normal. Okay, now let's just talk a little bit about park restrictions. So in an effort to keep people home, what we didn't want is to close the beach and then just have everybody go to one of these big regional parks. And so the mayor, along with the judge, have agreed to let's close the city's 8 big regional parks for that 4-day period. So the same time frame for our beach access closures is July 3rd, this Friday at 6 a.m., and it'll end Tuesday, July 7 at 6 a.m. And the 8 regional parks are listed here, and we're pretty familiar with them, right, as a community. Bill Witt, West Guth, the Manuel Salinas, the Water's Edge, and the Cole Park, big parks downtown. Labonte Park, Lakeview, and then Parker Park. So those parks will have restricted access. And so we've been asked, can you walk through the park? Yes, you can walk through the park. But the parking lots and kind of the drive gates with a vehicle into the park will be closed. They'll be barricaded. So if you live close by, like if you live across the street from Cole Park, you can still walk and go to the park. But by closing access, we're going to limit big groups of people, multiple parties and multiple cars going in and having barbecues and that type of thing. And if you do walk through the park, we do encourage, or if you're skateboarding, say even at Cole Park, you need a social distance, 6 to 12 feet. You probably should have a mask on. And you shouldn't associate with somebody that you don't know if you're in those parks to minimize the spread of COVID. Now, we do want to talk about the splash pads. So at Bill Witt and Salinas, those parks are going to be closed, and so therefore will the splash pads that we just opened up recently. But we have a third splash pad at Lyndale, and to minimize groups there, we can't really control like we can in swimming pools how many people go there. That we don't have staff that manages that, nor do we don't do any temperature checks or any of that sort. So the splash pad at Lyndale Park will be closed for that 4-day period. Lyndale Park won't be closed, they'll be open, but we're going to close the splash pad just to be on the safe side. Okay, so those 3 splash pads will be closed. The first 2 are closed because the park's closed, but the Lyndale Park splash pad we're going to close to minimize gathering since we don't have the capacity to staff that. Okay, and then one point of maybe good news is we do have 4 swimming pools, though, that will be open. On this slide here, we have they have been open, and we're not going to close those during that 4-day period. So Collier Pool, Corpus Christi Natatorium, the HEB Pool on Shelley Street, and then Greenwood Pool on Greenwood Drive. Those 4 pools will remain open. Their hours for general swim, and then there's other hours for lap swimming, but for the first 2 is 12 to 8. That's the Collier and the Natatorium, 12 p.m. to 8 p.m. The HEB Pool and the Greenwood Pool are 2 to 8 p.m. time frame for those 4-day period. And each of those pools, though, has a lap swim, so you may want to check online if you're interested in signing up for lap swim. So those are going to be open. Now the West Guth Pool, you may recall, West Guth is one of the 8 regional parks we're closing, so that pool will be closed for that 4-day period. Now the reason we're comfortable with keeping these open, though, the 4, is because we do have safety measures in place that were prescribed by the state, by the governor. And so we can only let 50% of our normal capacity of persons into those pool facilities. We have persons at the front gate. It's a controlled access, unlike the splash pads. So 50% pool capacity. So if you want to go, you may want to go early, or just be prepared to have to leave and come back, or wait until some folks leave the pool. And also at those 4 pools, we do take temperature checks. And so you can't be running a fever. We're going to take a temperature check like we do at City Hall. If you're running a fever, you won't be allowed to get into the pool. Okay? So that's a little bit of a hope, I guess, if it's will be hot, so you can take a quick swim if you'd like in those 4 pools in the city. Okay, so that was a lot of information. We'll place this on our website, this exact presentation I just went through. And as I mentioned in the beginning, the judge's order, and soon the mayor's reciprocating orders will be online. We're going to do a news release and put those out as well this afternoon. So that concludes my portion of the presentation. At this point, we're going to have Mayor McComb come up and speak to us. And then we'll have Annette Rodriguez with her video, or actually live feed, and then also following her will be Nueces County Judge Barbara Canales. Thank you.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 362 casos confirmados por el coronavirus, haciendo un total de 2,756 casos. El condado de Nueces es el condado en el estado con el mayor número de casos nuevos per cápita. Estos casos lo que están provocando es que lleguemos a la capacidad total para realizar pruebas en los hospitales y en los laboratorios. Se cuenta con una persona adicional fallecida quien perdió la vida anoche. Es un hombre en sus años 40 quien contaba con otros problemas de salud. Este paciente es el tercero en fallecer en la última semana. En promedio se llevan a cabo 540 tomas de especímenes al día. En promedio diario son 250 nuevos casos positivos al coronavirus. Se han identificado varios brotes del virus en diversos centros para adultos mayores, así como en el centro de residencia estatal. Para disminuir la propagación del virus, el condado de Nueces y la ciudad de Corpus Christi restringirán temporalmente el acceso vehicular a las playas de la bahía y del Golfo adentro del condado de Nueces durante el fin de semana feriado del 4 de julio. La restricción temporal del acceso vehicular comenzará el viernes 3 de julio del 2020 a las 6 de la mañana y finalizará el martes 7 de julio del 2020 a las 6 de la mañana. Las restricciones vehiculares también incluyen carros de golf, vehículos de todo terreno. Los residentes y visitantes pueden caminar por la playa una vez que esté firmada la orden. Esta va a entrar en vigor de manera inmediata. El cierre temporal incluye todas las playas de Port Aransas, además el Parque Nacional de la Isla del Padre, y el acceso vehicular se va a restringir durante el mismo periodo de 4 días. Además de los cierres temporales, todas las playas adentro del condado de Nueces están sujetas a un toque de queda que comienza el miércoles 1 de julio del 2020 entre las 8 de la noche y las 6 de la mañana. El toque de queda se va a levantar el sábado 11 de julio de las 6 de la mañana. Se les exhorta a todas las personas a mantener distanciamiento social, al menos si se encuentran en menos de 6 pies. No va a estar permitido socializar en las playas. Las albercas van a estar abiertas, las albercas Collier, H-E-B, el natatorio y Shelley. La alberca en Westwood Park va a estar cerrada ya que el parque se encuentra cerrado. Las albercas van a contar con restricciones ya que la entrada es limitada y también se va a tomar la temperatura a todos los visitantes. Las restricciones también continúan para Sunrise Beach, para el parque para vehículos recreacionales y las áreas del picnic y muelles van a estar cerradas por el mismo periodo de 4 días. Van a estar suspendidos los permisos para todos los vendedores ambulantes en las playas y así evitar un mayor número de visitantes en la playa. Los accesos para minusválidos estarán permitidos para quienes tengan permiso y podrán estacionarse en Packery Channel y en Bob Hall Pier. Las rampas para las embarcaciones van a estar accesibles. El estacionamiento en Packery Channel va a estar abierto. En cuanto a los salvavidas, habrá elementos de emergencia en las playas del Golfo y McGee, excepto en North Beach.
Thank you. I think it might be of interest to you to get a little bit of background or how the soup is made to come up with the rules and regulations that the judge is formulating, and that she doesn't do this by herself. She does this with multiple help and conference calls, and the beach closure particularly, there was a conference call, and it was a rather lengthy discussion, and Mayor Boujon from Port Aransas, David Parsons, the city manager, Peter Zanoni from here, myself, the judge, county attorneys, city attorneys. We really tried to cover all the bases and the pros and the cons and what's in the best interest of our community. And I think something that would be of interest to you is that some people are saying, well, you know, they recommend going to the beaches because it's sunny and it breezes. That's wonderful, and that's right. And they say, well, the beaches aren't causing the problem. Well, the beach itself isn't causing the problem. The beach is the lure to bring folks to our community. And when you have an additional 50 or 100,000 people coming into your community on the way to the beach, and as they spend the night to come back to the beach the next day, they're going into all the convenience stores, the restaurants, Academy to get sporting supplies. They're going to Home Depot. They could be going to Lowe's. They could be going elsewhere. And that's where a lot of the exposures are happening, is when they're mixing within the community in close ranges. And so it's not the beach that's the problem, it's the time away from the beach, but that's what brings them to town. And so we felt like to protect our citizens, we needed to make that move, and we hope you understand that and trust you understand that. But it doesn't give any of us any pleasure to shut the beaches down, because we know what an economic impact it is. But the health and safety of the community is one that we really need to focus on. And the beaches will be here when the COVID is gone. Hopefully the COVID's gone a lot quicker than it's moving right now, but we hope to get that done. But it was a pretty thorough discussion, and it was, not everybody agreed on every little part, but the ultimate decision was it's in the best interest of the county to do this, and the consistency is significant in terms of trying to get the city and the county's compliance with our recommendations. So we urge you to heed our warnings and follow the rules. It's in everyone's best interest that we do this, and the quicker we can get this problem solved, the better. I did have the pleasure earlier today of being over at Driscoll Children's Hospital to provide a proclamation for them on an event. And I took the time there to thank all of the workers that were able to get in the small gathering, because they're limiting the numbers even in the lobby there. But we need to thank all our medical workers at Christi Spawn, Driscoll Children's, Corpus Christi Medical Center, all of them. They are really going above and beyond duty. And we're a community with a grateful heart for their efforts and their energies and what they're putting in to trying to make us safe and keep us healthy. And we just want to say thank you. You can't say thank you enough. And so when you get a chance and you see that in our first responders, both police and fire, it's a never-ending route. These people are tired just like anybody else would be, but they keep going, because it's not just a job, it's a vocation for them, and they're committed to doing what they want to do. And we're just so appreciative of all their effort and energy. Another area that you as a citizen in the community could help is with blood donations. We're running low on supplies, and even though they have curtailed elective surgery, there's still necessary surgeries that happen. You've got emergencies, you've got automobile wrecks, you've got other things that do require surgery and do require blood. And we just encourage you to go down and make a donation, and particularly if you are a recovering COVID patient, that the plasma could be used to really help two people recover. So you get a twofer. So you can pat yourself on both sides of the back by going and donating blood to help two people recover. The quicker they can recover, get out of the hospital, obviously that lowers the numbers in the hospital or makes room for those that are coming after them, and so that we don't run into a shortage crisis. So we appreciate the community's response. The majority of the community has been wonderful, and we appreciate that very much. And on a side note, I think after this pandemic is over, it might be fun to publish a book of all the suggestions I get in through my emails. We have a lot of creative folks in the community. We've got a lot of good suggestions, and we've tried to apply as many of the good suggestions as we can. It's amazing the number of conspiracies that are out there, but it's fun reading. So we don't discourage anybody from writing, but it may be worth a book once this pandemic is over. So I hope as you plan for the 4th of July, you have a wonderful planning process, something to do with the family, enjoy the time together. I can tell you, as a father of 5 and a grandfather of 13, it's you never have enough time with your family. And so take advantage of this opportunity to stay home, cook a hot dog, cook a steak, cook a hamburger, whatever, and just enjoy the 4th of July and be thankful that you're an American. And we're going to get through this pandemic, and hopefully sooner than later. The more we have abiding by the suggestions that we have, the quicker we're going to get through it. So is Annette on now, or is she going to be, is this the judge? Annette's on now? All right. And by the way, Annette is doing a wonderful job for those of you out there. We don't get to say thank you enough to her, but she really is, she's putting lots of miles on her shoes these days and doing a great job for our county. So thank you, Annette.
En resumen, es importante que sepa que cada vez que se toma una medida de restricción, esa medida es cuestionada por varias personas, no es la decisión de una sola persona. Quiero que sepa que no nos da placer cerrar las playas ya que existe un impacto económico, pero cuando la gente acude a la playa también acude a otros lugares como las tiendas, y ahí es donde se puede ocurrir la contaminación y los contagios. Quiero reiterar el agradecimiento a todos los elementos de emergencia que han estado trabajando, como los médicos, policías y bomberos. Recuerde también que los recursos sanguíneos han disminuido. Es necesario continuar con la donación de sangre, especialmente aquellos que han superado el COVID-19. Espero que disfrute del Día de la Independencia y esté con su familia y agradezca ser norteamericano. Esperemos que esta emergencia pase pronto. Asimismo, quiero agradecer a la directora del Distrito de Salud Pública, Annette Rodríguez, por todo su trabajo realizado durante esta pandemia.
Annette Rodriguez, Public Health Director. Thank you, Mayor, for those kind words. The Health District received confirmation of our 9th death due to COVID-19 today in Nueces County. This patient was a male between the ages of 40 and 49. He was hospitalized in late June and had comorbidities, which were chronic obstructive pulmonary disease and type 2 diabetes. Our deepest condolences go out to his family and to his friends. So the week ending June 19th, I told everybody we had 212 cases for the week. The week ending June 26th, we had 951 cases. This week so far, and we're only on Wednesday, we still have to get to Friday, we have a total of 1,257 cases. So we all know that these numbers, as City Manager Peter Zanoni mentioned, aren't any good numbers, nothing to be proud of. So what can we do? We get tired of hearing bad news every day. What can we do? Why are we in this predicament that we're in? Hospital personnel, we all say these are our heroes, and they are. The nurses, the doctors, the administrators, and all the other ancillary personnel are working around the clock, as the mayor just mentioned, for all of us. So let's help them. And how can we do this? Hospital personnel are reaching out and pleading to us saying, please help us. We need your help right now. So we know that today we reported 167 COVID-19 hospitalizations between the 3 hospitals, 58 in ICU, and nearly half of them are on ventilators. This is an awful statistic. And this is the first time that we are reporting Driscoll to have COVID-19 patients hospitalized as well. So this is what we're going to do. It's not going to be anything difficult, but it's going to be something that we're all going to do together. The first thing I'm going to ask the community to do is to take care of yourself. You must take care of yourself if you're going to be able to take care of others. And how are you going to do that? You are going to get plenty of rest. You're going to also drink plenty of water. You're going to try to get exercise if you can. Eat healthier. But the other thing is, if COVID-19, if watching it, if looking at it on Facebook or social media is giving you a lot of anxiety, and you need to walk away from it, turn it off for a little while. There's no reason for you to have to watch it all day long. We do want you to stay aware of what's going on, but it's repetitive too. So you can watch it one time, walk away, do other things. As the mayor said, enjoy your family time. This is the perfect time to be able to do that. What else can you do? One thing that's really important is you can help guide your children. My mom used to say, God didn't make parents just to sit around. You need to guide those children. And how can you do that? These children, even their young adults, when they're sick, you need to take care of them, help them, but also let them know that they cannot go out and infect others. They believe that they're immune to everything and everybody else is immune along with them, and they are not. So it's very important that you guide them, explain to them that this is a virus, that nobody has antibodies to them. I found out recently they don't watch a lot of our press conferences, so at least my children said they don't watch them. So I want them to know that these are important things to remember. And so while they're sick, they can infect other people. It's important for us to guide them and to remind them of these issues. So this message, again, is for our community youth. Most of these community youth that we have, we're very fortunate. They're very strong, they're very healthy individuals, but they're not immune again to getting the virus. There are no antibodies out there and there is no vaccine. So if they do get COVID-19, So this is messages for you out there. If you're under the age of 25, if you get COVID-19, you must stay at home. Now, I'm going to say it's fine to Snapchat or visit with your friends via the telephone, but you cannot invite them over. You cannot go over to stay with them while you're sick. You have COVID-19 and you are in self-isolation. And even if you start feeling better, you know what? You're still in isolation for 14 days, and that's a requirement. You must stay home and you cannot go out because other people will get sick while you're feeling better. They will end up picking up that virus. So that's a really important message. Let me conclude by saying this is our community and this is our life. And we're all going to do the things that we need to do to save lives. And we're going to do it together. And so again, I'm going to remind you to stay home if at all possible. If you're a vulnerable population, stay home. Wash your hands often. 20 seconds at the minimum. Wash your hands often. If you leave and you come back home, the first thing you should be doing is washing your hands. I hope everybody's soap is running out currently, because it should be. You should be washing your hands that often. Social distance from others, at least 6 feet. Like the city manager said, 12 feet, 20 feet. As far apart as you can. You don't need to be close to anybody, especially strangers. And disinfect commonly touched areas, and don't touch your eyes, your nose, and your mouth with your dirty hands, because you could actually self-infect yourself. So these are simple but effective practices that will help in honoring our hospital heroes. They are working around the clock, like the mayor said, to save lives and to save our loved ones. So let's do our part and help them as well. Stay well, stay protected, and as always, stay informed. Thank you.
En resumen, el Distrito de Salud Pública del Condado de Nueces recibió notificación y confirmación de la muerte de un residente del condado debido al COVID-19. El paciente era un hombre de entre 40 y 49 años. El hombre fue hospitalizado a finales de junio y posteriormente falleció el día de hoy. Las comorbilidades del paciente incluyeron diabetes y la enfermedad pulmonar obstructiva crónica. Nuestro más sentido pésame a los familiares y amigos de los fallecidos. Los casos positivos en nuestra área continúan aumentando. El personal médico cada vez se va agotando. Lo que podemos hacer para ayudar es primero ayudarse a sí mismo. Descanse, tome agua, come saludable. Y si las redes sociales le dan ansiedad, déjelas por unos días. Ayude y guíe a sus hijos. Explíqueles la situación para que entiendan y recuerden tomar medidas. No existe aún vacuna ni tratamiento para el virus. Si usted ha sido diagnosticado, quédese en su casa hasta que se haya recuperado por completo y así evitar infectar a otras personas.
Barbara Canales, Nueces County Judge. This afternoon, I have 3 major items to discuss with you, and they are the same 3 items I discussed yesterday, but in a different order and with some supplemental information. Beaches and beach access for the July 4th weekend, hospital capacity and elective procedures, and the ongoing need for blood and convalescent plasma. With regards to beach access, I have filed the order regarding access to our beaches during the July 4th weekend. They will be similar to the orders we had in effect during Easter weekend, and we survived Easter weekend. Vehicular traffic will be prohibited, but pedestrian access will be allowed. Our Texas beaches are open, but access to them have been restricted. I've worked closely with the mayor and the city manager, as well as officials from our coastal parks, our federal partners, Padre Island National Seashore, and the State of Texas Parks Department, who run Mustang Island State Park. We all understand and agree that we have to have a common set of rules for the coastal parks, and we feel like we have achieved that. We also looked at our data and the rules we had in place for Easter weekend because we believe those were very effective. Remember, we did not restrict access for Memorial Day, and how much that contributed to our current situation and crisis is difficult to say, but we do have the facts, and the facts show that we had a sudden increase happen after that 2 to 3 week time period after Memorial Day weekend when we did not restrict the beach access. I've called on our beaches as the crown jewel of Texas, and I have a personal connection to Texas Open Beaches Act, which ensures that Texans have the right to be on our beaches. And this is a right I cherish as many of our fellow Texans do side with me. This restriction will go into effect today, which is Wednesday, and expires Tuesday morning, July 7th, after the holiday weekend. Now, we are doing what we know works with this and with our other orders, and we will pray and hope that it will flatten the curve again. We do not want to return to stay-at-home orders, which had a detrimental effect to our Texas economy. This is how we can achieve that. Now, here's some supplemental information that I think you will find informative and I hope helpful. To those of you that have limitations and really rely upon the American Disabilities Act, you should know that there are special provisions for those with ADA accommodations to access our beaches. So we have made sure that our order refers to our ADA accommodations, not only at Bob Hall Pier, but also at IB McGee. So with regards to ADA, parking, and accessibility, those accommodations are there for you. And if you have any questions whatsoever, don't hesitate to contact us at county.attorney@nuecesco.com. In addition, I want to make certain that everybody understand that while the beaches are open, the entire spirit of this is really to make certain that we can do everything in our power to mitigate the ever-increasing number of COVID positive cases. And why? Because our hospitals are surging with numbers of hospitalizations, with ventilations, and with intensive care beds being occupied. As we serve as a regional provider for healthcare, the issue of hospital capacity is the next subject matter for today. Hospital capacity had a direct link to Governor Abbott's order yesterday, his proclamation suspending elective surgeries at hospitals in the following counties: Cameron, Hidalgo, Nueces, and Webb counties, to ensure that hospital bed availability for COVID-19 patients in these communities would be available. This proclamation amends the governor's previous executive orders, which really focused on the largest urban centers that were having a huge problem with their hospital capacity. That was Bear, Dallas, Travis, and Harris. Now, we sadly, as I told you yesterday, we're among that group. So, when we see this proclamation, we know that it's in an effort to ensure that every COVID-19 patient who needs a bed has access to one. So under the order, as you know, I said this yesterday, the governor directs all hospitals in these counties to postpone surgeries and procedures that are not immediate or medically necessary to correct a serious medical condition, or to preserve the life of a patient who, without immediate performance of the surgery, would be at risk for serious adverse medical consequences or death. So the governor can add or subtract from the list of counties, and he may do so, and he can address these surges and hospitalizations that may arise in the interest of public health. So this told us yesterday, and I have no different news to report. In fact, I think our news is more serious than it was yesterday. And because we are in this very serious situation, I want to remind you that, as I said, Nueces County serves many, many counties, over 17 counties in our geographic region, as a regional healthcare provider. So when those procedures are restricted, they are affecting everybody who relies upon our hospital care here in the coastal bend. Second, we know that when this ban was implemented earlier in the year, many patients stopped getting treatment, and sometimes their conditions got worse. And that's not the purpose of this rule at all. It's not designed to hurt anybody who needs an important procedure or surgery. We don't want people to stop getting treatment. We want you to continue to discuss this condition, any health condition you have, with your doctor. And as a result, your doctor would probably give you the best advice as to whether you need to explore other treatments or whether it can wait. But at all costs, you want to make the best informed decision. So be sure and consult your doctor. Don't assume because no elective surgeries are being held that necessarily applies to you or your situation. Finally, I want to re-urge everybody to help me help others by finding somebody who has recovered from COVID-19 and urge them to call 888-0264 to give blood to save 2 lives. Every time one blood donor who has recovered from COVID-19 gives, we can save 2 lives with their blood. And so I think that it's really critical at this time to do everything we can to make certain that we meet the needs of our community. We need 100 donors, and I really need your help to help me reach out through our social networks. Anything you can do, your family networks, your colleagues. We all know somebody who knows somebody who's recovered from COVID-19. And yesterday I was almost frustrated because I'd only gotten 3 calls. Well, let me share some good news with you. Today I was able to field some calls on my own cell phone. People who said, remember me, Judge? I was COVID-19 positive and you helped me get tested and I now want to give back. I want to thank everybody who's reached out to me. I also want to thank those members of our corporate community who's made it possible to create even more incentives for our COVID-19 positive patients to be able to receive a $100 gift certificate upon the donation of their blood. We know it's a sacrifice. We know it'll take an hour of your time, most likely getting there and coming back, and an hour to give, and we know that your time is valuable, but we know that saving a life there is no greater calling. And so please, once again, take a look at the screen. It's coastalbedbloodcenter.org for more information about the process and a little bit about the therapy and how it works to save human life. But if you want an appointment and if you want some help getting all organized with the forms and you meet the criteria, please call us 888-0264 and we will help you get organized. Finally, let me say those are my 3 topics. I'm always happy to give you a little bit of encouragement and inspiration. Yesterday was a hard day. It was hard for me personally. I hate coming and sharing information that is negative, that cases are going up and that hospitalizations are going up and ICU beds, and it seems like it's all bad news. Well, let me say that our spirit is one of resiliency here in the Coastal Bend, and I am focused and determined that we are going to do everything in our power possible to get increased testing for those of you that are patiently waiting, to make certain that for those of you that have loved ones that are getting treated in the hospital that will get this vital blood, and most importantly, that we will take the actions together as neighbors, as friends, as community citizens that care about each other to do whatever it takes to make certain that we can reduce the spread of this virus. So today, I renew my smile and my optimism because I know that the actions we've taken are going to yield a better result for our tomorrow. Thank you, and I stand ready to answer any questions from the media via email or my cellular. Thanks.
En resumen, ya ha emitido la orden para la restricción al paso vehicular en las playas del condado, desde Port Aransas hasta la playa nacional. La restricción entra en vigor desde hoy hasta el día martes. Para las personas con discapacidades habrá disponibilidad en varias áreas, esencialmente en estacionamientos. La capacidad en los hospitales cambió cuando se enmendó la orden del gobernador para suspender las cirugías selectivas en varios condados, incluyendo Nueces, a menos de que la salud del paciente esté en riesgo. Les recuerdo que los hospitales locales atienden a residentes de 17 condados circunvecinos. Finalmente, le pido que done sangre, especialmente si se ha recuperado del COVID-19. La situación es crítica. Una persona puede salvar a 2 más. Se le pide llamar al 888-0264 para realizar los trámites y pautar una cita. Aquellos donantes van a recibir un pago por esa donación. Les recuerdo que estamos haciendo todo lo posible por obtener todos los recursos necesarios para continuar realizando las pruebas de detección del virus.
Okay, that concludes our remarks for today, and we're here I'm here anyway, to answer any questions that you may have. Media, no questions? Okay, good. You guys will let me out of here easy. So tomorrow's Thursday. Tomorrow we're going to have our briefing at 5 o'clock, and it'll be myself, I think the mayor and Judge Canales and Annette may have a few words, but the main presenter tomorrow will be Dr. Bird from Texas A&M Corpus Christi. And he's been tracking this data. They've been having daily conference calls our staff has with his team. So tomorrow we'll dedicate a good portion of the time for his presentation, update, and perspective. Okay, so we'll see you tomorrow at 5 o'clock. Be safe. Thank you.